When it comes to chronic pain, many people feel like that they've tried everything, but growing research suggests a new path does exist for relief. Now, July is actually Chronic Disease Awareness Month, and we're joined today by Dr. David Clark, who's shedding light on new ways to reduce pain and actually flip the script, if you will, on how we view pain and how it manifests in the body. Dr. Clark, thank you so much for joining us this morning. I want to talk about this key term that we're hearing a lot about now in the medical field, neuroplastic symptoms. What are they?
Well, let's back up for 1 second and just remind everybody that it's a common assumption that if you've got pain or illness, it must be coming from disease or injury. But it turns out there's this whole other category, the neuroplastic category, where symptoms are generated in the body, very real, but they're generated by the brain. And that's where the neuro comes from. And the plastic is actually very hopeful because in medical jargon, it means there's a capacity for change.
Oh, okay, that's brilliant. Okay, so let's talk about those neuroplastic symptoms. So what might be some of these symptoms that people will experience? And what I find quite fascinating is that they also include diagnosis that you might receive from a physician saying you have IBS, you have vestibular migraine, but there's actually potentially some neuroplasticity to this. Explain that.
Yeah, the symptoms actually can be literally from head to toe. Migraines, dizziness, visual disturbances, temporomandibular joint problems, difficulty swallowing, pain in the back or in the neck is a big one. Irritable bowel, you mentioned, fibromyalgia, long COVID, chronic fatigue, certain kinds of rashes, muscle and joint pain. The list just goes on and on that can have a neuroplastic contribution to them. Even if the physician has labeled it with something, if the treatment is not improving your condition as the doctor expects, then a neuroplastic condition might be the reason why.
Okay, all right, and really quick, so there might actually be clinical reasons why someone has symptoms. How does somebody figure out if it is a clinical diagnosis or if there's neuroplasticity at play? And second, I'm going to ask you, could there potentially be both at play at the same time?
Yes, both could be going on at the same time, but you always have to start with a visit to your physician to look for structural damage or organ disease. But if those are not found, then it's important to start looking for neuroplastic causes. And these are linked to stress, trauma, emotions, other challenges in life that can happen to anybody. And we look into those, we investigate for those, we generally will uncover them, and then they can be treated and people who can get better, even if they've been ill for years or even decades.
My goodness, even decades. Okay, so we're talking relief that is very differently treated. How is a treatment different?
Yeah, we're looking for stresses in a person's life. One of the big ones is stress when a person was a child, treatment that you experienced when you were a kid that you would never want for a child of your own, for example. That can have long-term consequences. One extreme example in my own practice was a woman who was still having pain at age 87 over something that happened to her when she was 8, when she went through a trauma. But even that patient was successfully treated by uncovering the real cause.
Okay, so we're talking about then emotional processing in releasing trauma and acknowledgement. So a lot of mental health and wellness really involved in this space, in addition to ruling out, like you'd mentioned, that clinical portion as well and its possible attribution. Dr. Clark, where do people go so they can understand if this is something that they should be looking into?
Yeah, on the website symptomatic.me, we're a nonprofit, but we have a 12-question quiz, takes people less than 3 minutes, where you can assess yourself to see the likelihood that these issues are playing out in your own condition.
Wonderful. And that website one more time, Dr. Clark?
Symptomatic.me. We're a nonprofit. We're led by volunteers.
Wonderful. Dr. Clark, thank you. Thank you so much. Greatly appreciate your time and sharing this message for our audience. Hopefully we helped a lot of people today. Everyone at home, stick around. More to come here on Idaho Today right after the break.